you, Natalie. Over to Anne.
Hi, Natalie and everybody. My name is Anne. Like Sam, I'm here as a patient advocate, speaking up on behalf of the estimated 400 million long COVID sufferers worldwide. I'm going to briefly tell you about my experience, although of course it's not a unique story. I caught COVID for the first time in 2021. I was 39. I had 2 jobs at the time. I was very fit and healthy. Just like everybody else, I was led to believe by the public health information that due to my age and good health, I didn't need to worry about COVID and that getting infected would boost my natural immunity. I tested positive on October the 20th and I was disabled by it. I was unable to walk, stand or sit up. I had over 40 symptoms in all. I couldn't take a full breath in for over a year. I'd wake up throughout the night gasping for air. I experienced chest pains, heart palpitations, vibrations throughout my body, muscle spasms, tinnitus, my hair fell out in clumps, my vision has been affected. I had dizziness, blackouts, and I lost 2 stone in 8 weeks. The worst symptom for me was the headaches. I had constant pressure and stabbing pains in my head for all the time. It was then discovered many months into this suffering and after lots of GP and A&E visits that my blood was clotting. I was unable to care for my children who were 4 and 6. I was unable to work and I subsequently lost one of my jobs. My husband, who also caught COVID at the same time as me and also developed long COVID symptoms, had to become my carer. Recovery has been slow and is not a linear process. Many things can trigger a relapse in symptoms, so have to be avoided. Long COVID forces you to adjust your expectations and to live within new limitations. And I now accept that there are things that I just can't do anymore. There isn't an area of my life or a relationship that has not been negatively impacted by COVID, but I know that I am one of the lucky ones. There are many others with long COVID, sorry, who have
take your time. That's fine.
Who have seen no improvement. We celebrate every small win. Sorry. And I'm grateful to be here to speak up for those who can't. To this day, I'm yet to receive a single effective treatment from a medical professional in this country. It became apparent very quickly that there is no help available to those who don't fully recover from COVID. GPs, A&Es and the long COVID clinics all have nothing helpful to offer, so I gave up asking. I was informed by an occupational therapist from the long COVID clinic that I didn't qualify for a wheelchair because I wouldn't be using it inside my house, so I had to borrow one from charity. I, like millions of others, have had to turn instead to social media for my medical advice, desperately trying and buying untested supplements and therapies recommended by strangers online with sometimes disastrous results. To add insult to injury, today long COVID sufferers are not eligible for a vaccine, and we're also being refused access to the antiviral Paxlovid when we're reinfected, even though this is available to other groups. We are apparently not vulnerable enough to COVID, the virus which has already destroyed our health. To be frank, we have been hung out to dry. Reinfections are a constant concern for anyone who understands the risk. I know that the progress that I have seen since 2021 is not guaranteed. Reinfections are hitting people very hard. Our one and only priority is to try and maintain our baseline so that we can look after our children. Yet, there are no protective measures anywhere, which makes it extremely difficult for us to be a part of our community. This includes my doctor's surgery, my workplace, my children's school, places we can't avoid. Windows shut, no air filters, no effective masks, nobody testing. People who are symptomatic are encouraged to still attend. We've missed doctor's appointments, family gatherings, funerals, and children's parties, amongst lots of other things. On Freedom Day, we were told that we have personal responsibility to assess our own risk. The government then systematically dismantled ONS data collection and monitoring so that we are not able to assess prevalence or risk. As a family, knowing what we know, we're as careful as we can be. We test, we avoid busy indoor places, we bring our own air filters with us, and we wear effective masks. But it is a losing battle because you can't do public health on your own. There is a wall of silence about COVID and non-COVID. Politicians don't mention it, the media don't report it, the UK HSA gave up, and the ONS has now stopped bothering to count how many people have got long COVID. Despite the overwhelming scientific evidence, there are no public health warnings. Most people, including healthcare workers, genuinely have no idea about the array of symptoms that long COVID includes, thinking it just means that we're feeling a bit tired. Consequently, there is widespread misunderstanding and misdiagnosis. Since day one of this pandemic, morbidity has been ignored and hidden. Still, despite the COVID inquiry evidence, no one is telling people that it spreads through the air. So blue paper masks, plastic screens, and hand sanitizer don't help. Still, nobody is telling women my age, for example, that they are one of the highest risk groups to develop long-term symptoms of COVID. And most worrying of all, parents are unaware that children are suffering. At the last count in England and Scotland alone, there were approximately 112,000 children living with long COVID, a number which has doubled in the last year. Contrary to popular belief, children are not immune to the damage COVID causes, and we are doing nothing to prevent them all being infected 2 or 3 times a year. As predicted, it is becoming increasingly difficult for all governments to ignore the steep rise in long-term sickness. The online long COVID groups that I am in are enormous. Every day there are new members joining, previously healthy people who now, after their 4th, 5th or 6th infection, are horrified by their lasting symptoms for which there is no treatment or cure, which has been caused by a virus that they have been told is like a cold and a pandemic that they have been led to believe is over. The same story is repeated over and over again. The inconvenient truth is that it is not just the vulnerable who are affected by COVID. We're all vulnerable, and we're one infection away from developing the many and varied symptoms of long COVID. The World Health Organization have told us that the pandemic is ongoing, and they've warned us that we're all rolling the dice with every infection, but the UK HSA chooses not to convey that message. We need access to apolitical public health information. I joined the Green Party because this is the only political party whose members are doing anything about long COVID. Joining this policy working group and reading our statement gives me hope. It offers solutions and it proves that we don't need to choose between lockdowns and doing nothing, and there are lots of options in between. Apart from being morally wrong, sweeping millions of chronically ill and clinically vulnerable people under the carpet is not a long-term plan. How many more people need to become chronically ill before we act? Public health is failing, and we can do so much better than this. Prevention is always better than cure, especially when there is no cure. The Green Party has got a unique opportunity here to be the first party in the UK to publicly address the ongoing crisis and propose a pragmatic way forward. This policy will be welcomed by voters, and it will be a ray of hope for people like me and my family. Thank you.
Well, thank you very much, Anne, we can see obviously it's very, very difficult. So thank you for taking the energy and the time and advocating, and very best of luck to you and your family.